Knock, knock, knock.
Hello.
Hello. I'm just going to wash my hands really quickly. How are you today? I'm
Good.
Caitlin. I'm going to be your NP. What's your name?
Jim.
Nice to meet you. What brings you in today?
I'm here for physical assessment.
All right, perfect. Well, we're just going to get started, okay?
Okay.
Please let me know if you have any pain, any tenderness as we go. And I'm just going to ask you to do a few things, and I'm just going to assess you as we go.
Okay.
So first I'm going to ask you to take your chin and lift it to your chest. Perfect. That's flexion. You don't have to use your hands if you don't want to. And then back up to the normal position. Just like this. Perfect. And then I'm going to have you take, so his flexion is good. Take your head and bend it backwards. Extension. Awesome.
Oh, okay.
You're doing good. All right. And then take your chin and turn it to your left, left shoulder.
Okay.
That's okay. That's okay. And then take your other, this is for rotation. Take your other chin, turn it to your right shoulder. Awesome. So rotation is good. And then this is a tough one. I'm gonna have you take your ear, your right ear, and bring it to your right shoulder. Okay, without bringing your shoulders up. Awesome. And then back to midline. And then your left ear to your left shoulder. Can you go further than that or no?
No.
Okay, that's great. Good job. So he actually had neck surgery, so we won't make him do all that. But so he has limited mobility, but his coronary nerves are working with side bending also. So now we're going to move on, and we're going to talk about your thyroid. Okay, so I'm going to come at you from the front and palpate your thyroid, and then I'm going to also come from behind, okay, and palpate your thyroid. And you just let me know if you have any pain or tenderness, okay? So we're just going to look and palpate your thyroid. All right, any pain with that? And his trachea, his midline.
No.
I'm going to come from behind and just palpate it from here. So everything feels midline. All right, and then I'm going to have you pretend that you have like water in your mouth and take a gulp. And if you need me to get you some water, I can. So swallow. Perfect. That was awesome. So everything feels good there. It's medial. I don't feel anything out of the ordinary. Next, we're going to palpate. I'm going to feel for your lymph nodes, okay? So please let me know if you have any pain or tenderness in any of these places, okay? I'm going to touch you now. Is that okay? All right. So first, we're going to do with pre-auricular and then post-auricular. We're going to move to occipital. And then tonsillar. And submandibular. And submental. Any tenderness in any of these places so far? All right.
Nope.
We're going to move on to doing okay?
Mm-hmm.
All right. Posterior cervical and anterior cervical, and then supraclavicular and infraclavicular. All right, so no pain, no tenderness?
No.
All right, so no, his lymph nodes were non-tender. I couldn't even actually feel some of them, and non-firm and not movable. Next, we're going to move on and talk about your abdomen. So I'm going to actually ask you to just lay down on our bed or our exam table, and then I'll give you this towel you can cover up if you want to on your lower half, or all you need to do is lift your shirt up from here, and I'll give you some privacy, and I'll be back.
I'm ready.
Alrighty, perfect. So first we're going to, we're just going to inspect your abdomen, okay? So looking at it, it looks symmetrical. He's flat, normal symmetry, normal hair distribution, and
Are you talking about my head or my stomach here?
your stomach.
Okay.
I don't see any vascular features, and his umbilicus is in the midline. So now we're going to listen. I'm going to listen to each quadrant, and I'm going to tell you what we're doing as we go. And please just tell me if you have any pain or tenderness as we go, okay?
Okay.
So we're going to listen to the right upper first. And I can hear peristalsis, so that's good. Left upper. Left lower. Right lower. All right, and I'm just listening for stomach churning, peristalsis, hearing those guts going. And I hear all that, so that's good. Next, I'm going to listen to his aortic and renal arteries. So just make sure that I don't hear anything there. Perfect. So we'll go to the left one. The left renal artery, the aortic, was first. And here's my right renal artery. Okay. And I don't hear any aortic or renal bruits, so that's good. Next, we're going to percuss your abdomen. So I'm going to touch it again if that's okay. And let me know if you have any pain or tenderness as we go. So I'm just going to perfect, right upper, left, lower. All right, no tenderness in there?
No.
Okay, I'm going to actually now palpate your liver. So it's going right here. Perfect. And your spleen. All right, so I don't hear anything out of the ordinary there. When I'm percussing, everything sounds normal. I'm going to actually have you, I'm going to help you. I'm going to sit you up for a second, okay? Perfect. And I'm going to percuss his CVA, so his costovertebral angle. And what I'm going to do, sorry, it's kind of hard to see with the video, is I'm going to have my fist on his back, and then I'm just going to palpate. So I'm listening for anything out of the ordinary. Everything sounds good there. I don't hear any dullness. All right, now you can lean back. Sorry about that. So no CVA tenderness. And then next we're going to palpate. So I'm going to start with some light palpation, and then I'm going to get to deeper palpation. Just let me know if you have any pain or tenderness. So we're going to palpate first with light, and just do light in the right upper, left lower, right lower. Any pain so far?
No.
All right, moving on, we're going to palpate in the little bit deeper. Okay, left lower and right lower. No pain, no tenderness. Sorry,
No.
so no pain, no tenderness. Everything feels good there. And then we're going to also check his, for rebound tenderness. So that's in his right lower quadrant. You just let me know what hurts, if it hurts when I push in or when I go out, or when I let go, or if you have any pain at all, okay? So, all right. Was there any pain or tenderness there?
No.
Okay, so no rebound tenderness. I'm going to actually check for Murphy's sign now. So I'm going to go to his right upper quadrant and look for his liver. I'm going to palpate right in here. And I'm going to have you take a deep breath and then let it out. And I'm going to push in a little bit. All right. Any pain, any tenderness with that?
No.
All right, good. So negative Murphy's sign. And the last thing we're going to do is, you're a little bit tall for this exam table, but perfect. So I'm going to have you lift up against my hand. Wait, I'm not ready yet. And you're doing great, though. Let me know if you have any pain down in this lower abdominal area, okay?
Okay.
So lift up against my hand. I'm going to push against you. Perfect. Okay. Very strong. Any pain there?
No.
All right. We'll do the other side. All right. No pain?
No.
And normally they would be on a longer bed and their fan would be out like this, and they would lift up just like that and see if he has, obviously he has really good abs, so it's not hard for him to lift. So that would be a negative iliopsoas sign. And that would be all for our assessment today. So you did great. Let me help you up.
Oh, thanks.
You did awesome.